Barbara and I had the chance to go over at least some of what we might say. And so I think, Barbara, if you would take the lead and go ahead and share, and then I'll just chime in afterwards.
Yeah, so can you hear me? Can you hear me? Yeah,
I can hear you.
Yes.
Yeah, so what we kind of worked out is I was going to talk a little bit about what the community health centers are doing as kind of an example of what a lot of outpatient services are doing. And then we didn't kind of work out which would go next, but I was prepared to talk a little bit about disaster mental health and the reactions people may be having, and Art was going to talk about
what's going on public health wise and you know, organized medicine wise in the community.
Yeah. Okay, and each of those sections should take about 5 minutes or a little bit less, hopefully. Okay, so I'll lead off and then maybe you can jump in with your part and then I'll finish off with the mental health. We're still working this out, of course. Okay, so I am a retired physician assistant and I'm also a disaster medical responder. And I do work with the nonprofit community health centers in Alameda County. And like I said, I'm going to talk a little bit about what the community clinics are doing because it reflects, I think, what is happening in a lot of different healthcare settings, you know, that may be different than what you're used to seeing. So the community health centers are committed to being available to the community. And we know that as things get crazier, that this is going to be an important asset. But we're also refocusing our services. So if you are a member or a patient at one of the community health centers and you had a routine appointment, you might have found that those have been canceled because they're focusing on and refocusing all of their services on urgent care, sometimes consolidating which sites are open and carefully staffing their sites with people who are less likely to develop complications and are sometimes some sites are just easier to make safe for something like COVID. And a lot of them are heavily using telemedicine. And you may have already noticed this if you've tried to get care at Kaiser or anywhere else, which is a good thing because they can talk and you don't have to go and expose yourself when, you know, by going into a real visit. So if you are sick, do seek care wherever you get your care, but do call in first. And kind of in a nutshell, the strategy that we're having to adopt in all of the healthcare facilities is getting people to the right level of care. So for people who are mildly sick, you may be asked to, you know, you'll be screened, but then asked to take care of yourself at home. And then people who are moderately sick and also have risk factors, then there'll be other options. And we're trying to do that so that we can leave room at the hospitals and in the intensive care units for the people who are severely ill. When you do call in to get care, if you or one of your loved ones is sick, we will be interested not only in your symptoms, but also whether you're at risk for developing complications. So if you do have diabetes or high blood pressure, don't assume that the person you're talking to knows that. Be sure to mention that also. And also whether you have support at home. And this is particularly important for people who either live alone or who live with a lot of people, because both of those are trickier for figuring out what's the best situation for you where you should be. I should mention that if you're thinking, oh my gosh, my loved one should be in the hospital, or I should be in the hospital because I think I might have COVID, that when you're at home, you're going to get better food. You're going to have more privacy. You're probably going to sleep better. And your family will be around you at a distance, but they'll be around you. Whereas if you're a COVID patient and you're in the hospital, nobody can come into your room in order to protect them from picking it up. So those are things to consider, you know, when you're deciding whether you want to push that, oh, I really need to be in the hospital because I think I might have it, or whether you really can manage yourself at home. The other thing is that if you or somebody in your family is sick and you're thinking that they might have COVID, you might not be able to get testing, or it might be difficult to get testing. But one of the things you want to do is have only one person going in and out of their room. And that should be somebody who isn't themselves at really high risk, so that you don't have all of the family members getting exposed at the same time. Around the Bay Area, sites are being set up for people who can't stay at home for various reasons. And this is part of that various levels of care that I was talking about. And it's different than what you're used to seeing. So I guess the message is, you know, that if you get sick, if one of your family members gets sick, to be flexible, to realize that there are a lot of different levels of care, staying at home, special care centers for people who are sick, but not needing to be in a hospital. There's hospital level care, and there's, of course, intensive care level care. So do call if you're worried. Call into your regular health care rather than dashing in or calling 911 or running into the emergency room unless it truly is an emergency. And also advocate for yourself and for your loved ones, so that if there are risk factors or there are things that you're worried about, you know, I would like to be able to stay at home, but I can't for these reasons, to be sure to put that out there so that you can get yourself or your loved one to the right level of care. So Art, do you have anything to add to that, or?
Not a lot. That was really great, Barbara. I really don't. I mean, you covered everything. Just to reiterate, the main message, I think, is that if you really do feel you're sick and you need to be seen, call and alert people, because then, we take the proper precautions, and then also can give you a sense of whether it's okay to just come into the office or whether you really do need to head to an emergency room and get a further evaluation. I think our systems are set up to be able to deal with any situation, but it's this, we're trying to avoid unnecessary overload in any one particular area.
Did you have stuff you wanted to add about the county level preparations?
Yeah, okay. So moving on to just some of the other things that we're doing. I wanted to take one step back because I know, Jill, you had some specific questions for us. You wanted to make sure that you checked in on us and, on the impact. I want to give Barbara a chance to respond to that too. But, the starting point for all of us, I think, and looking at the people that are on the screen and so on is, we're very fortunate to be in a position where we are not having to deal with, finding food or shelter. We're comfortable in our homes, we're online. We have to just take that into consideration, and hopefully have jobs or are retired and okay with income. The sheltering in place has been a real challenge for a lot of people. I know some of the other speakers are going to address some of the psychological aspects of that. But it is tough. And as we're all experiencing this, the social distancing and the hand hygiene, it takes a while to totally integrate that into our habits. And, depending on how compulsive we are or how laid back we are about these things, makes all the difference as to whether or not we're putting ourselves at risk or putting our loved ones or others at risk. And so, that is really what I try to underscore, is because I see it all over, and I even see it among my doctor colleagues, who some say, are talking to me 3 feet from me, and I just start backing up, and they go, come on. And I just have to say, hey, look, let's follow the rules. If we're going to be putting this out there, we have to practice what we preach. The issue of hand hygiene, there are some really excellent videos that go into detail so that people can deeply understand why soap and water and why the 20-second rule. And some of that deep understanding helps motivate people to actually do it the right way. and recognize that that's one of our best weapons right now for preventing transmission. But anyone who's gone into the store to buy your food knows that there's so many touches, and every time you touch something, there's a chance that someone else has touched it. I just went in about a week ago just to buy a carton of milk and a carton of eggs, and realized that as soon as I touched the milk, I knew that someone had to put that on the shelf, and then I didn't know whether or not anyone else had touched it, and there were only 6 dozen eggs left, and so I knew that maybe somebody had already touched that dozen, the carton. The whole thing around how long viruses live in different settings, all to say that there's no reason to cut yourself short from compulsive behavior. When you leave a store, when you enter a store, cleaning off the shopping cart, cleaning off your own hands. When you get back into your car, using hand sanitizer again. Some people use gloves when they go shopping. All of these things can be really helpful and just limit risk, even though we're turning into a real obsessive compulsive society about that. But that's essentially what it takes to protect yourself and your loved ones. And I think, and as far as what we're doing in the county, we are on an organized medicine level. I participate with my local public health department, and then also with my county medical association. Medical associations and organized medicine in California and also in the county is trying to do what they can to assist the physician and health professional practices in maintaining their services and trying to be accessible at a time when most people are afraid to go into a doctor's office or a clinic just because of the risks of sitting next to somebody that might transmit. And so it's assisting people in the shift towards telehealth, which sounds easy, but gets a little bit complicated because of the laws around privacy and how information is transferred, and how to make sure that the person you're talking to on the other end of the phone is in a private place or is accepting of the fact that there's other people listening. And so they are, this is a regulation that we have to maintain compliance with. And so there are rules and regulations on a simple telephone call that we're trying to educate our providers with, so that they can be in compliance and not face any kind of penalties and so on. It's assisting them with getting their the personal protective equipment. Most of the people you've heard, there's a big shortage, and this is spotty throughout different parts of the county and the state and the country. And so trying to put a message out and coordinate the demand and the supply, so that there is an adequate supply, with whatever situation people find themselves in the workforce. And the last thing is trying to bolster the workforce and trying to make sure that, we know the surge is coming. And when the surge comes, there's going to be a shortage, because a lot of providers who are on the front lines are going to drop out as a result of getting COVID-19. And they're also going to be really overworked and tired and stressed out. And so we're looking at organizing a lot of the folks that are either retired or part-time, and trying to mobilize that force to be available as a backup and a reserve to fill in when the time comes. Hopefully it won't be necessary, but we know, we've got to be prepared for the worst and hope for the best in the meantime. And then the last thing is just constantly trying to make good information available to the public around the clinical care, because you hear a lot of rumors about this remedy or that remedy, this vitamin or that remedy, that vitamin. Trying to give good objective information and connect people with the websites that provide that. And so somewhere near the end of this call, I can pass on a number of those websites that you can look up pretty easily. I'll stop there.
Okay. So I was gonna talk about the common symptoms in disasters, Jill, unless you wanted to go into other specific questions.
Why don't you go ahead?
Yeah, then we'll kind of
move on to the next.
Okay. So a lot of you, a lot of us are feeling like we don't feel like our regular selves, not the same energy, not the same sleep. And this is a disaster. It's not, it's more slow moving and kind of up and down compared to, you know, when a major earthquake happens, we kind of know when that happened. But the emotional impact is the same. And since I do disaster work, I wanted to share some of the real common things that we go through whenever we're in a disaster. So if you're not feeling quite the same, it's because we are actually in a disaster. So the most common reactions that you may be having or you may be seeing in your family members are trouble sleeping. It could be either that you can't sleep or that you feel like you want to sleep all the time. Both of those are completely normal reactions. People being more easily upset. You're kind of on edge. Another one is thinking over and over about things. And this is actually something that you want to avoid. Overthinking, don't leave the news on all day. It's going to drive you nuts and make you more anxious than you need to be. So I suggest, for example, that you watch the news maybe twice a day, listen to it on the radio. And this is one that doesn't move that fast. So if you get updated twice a day, you're going to know what you need to know rather than listening to it over and over again. Trouble listening. You may find family members feel really pretty distracted. And the one that hits me a lot is difficulty concentrating and paying attention. So with your kids, if you've got kids or grandkids around your house and you're trying to get them to do their lessons and to keep up on their learning, they might need to take it in bits and pieces rather than being able to sit down and, you know, plow through 2 hours of sessions. So try to take this in bite-sized pieces. And the last thing is that for those of you who are not feeling like your usual self, this is a normal reaction to an abnormal situation. So it's normal. Mm-hmm. It's not always comfortable, but it's something to be expected. It doesn't mean that you are completely out of control. And the last thing that I wanted to talk about, and I'm going to try to put this graph where you can also follow it, but with, let me see if I can get this where you can see it. Okay, oh, there you go. Let me see if I can get this and talk at the same time. Mm-hmm. So this is kind of a curve where the pink part is the impact or the threat. And then the second period is kind of the shock or heroic period. And we see that a lot. I mean, we have healthcare workers who are stepping up. People are helping their neighbors. People are really going to great extents to pitch in. And this is a really wonderful thing to see happening. Then there tends to be kind of a honeymoon period where people are still very positive. You know, we're pulling together, we're doing this together. And this is kind of the period where we are kind of the heroic and the honeymoon period. And for you to be aware that in all disasters, as things, if people get tired and more tired and things kind of plow along, that we do tend to go into this disillusionment period where people feel kind of let down. And we're right now in a mix of this because we've got all this political stuff going on. But people are feeling like we didn't do it right. It's not going as well. Hey, you did this wrong. They should have done that wrong. And a lot of that negativity. And that can lead to a really negative period. Especially, I think, in the Bay Area, when we start to have a lot of deaths, there's going to be a lot of accusations about who didn't do what. And that is kind of par for the course. This is kind of what happens. But gradually, we kind of bump our way out of that and back toward normal, or what I think is always going to be a new normal. that it's not going to be the same normal that we used to have. There'll be different things that we're afraid of. And then there'll also be other things that are much better, because we now can do telemedicine, and we found other ways for kids to learn when they aren't in the classroom. And people are stepping up and doing new and different things. So you can expect that right now we're in a good period, and we should continue to be stepping up and pulling together. But that disillusionment period is also something that we can kind of expect eventually will happen. And I think it will especially happen when we start to have more deaths in our area.
Wow.
Yeah.
Huh. Thank you, Barbara. That was very helpful. Yeah, I've been feeling all of those things.
Yes.
Yeah. So I want to introduce our next speakers, Alan Maeda and Diane Wong. And Alan is a licensed therapist and also a volunteer facilitator at JSei. He helps facilitate our family caregiver support group, men's group, and will be co-facilitating with Vida, Jacqueline, a new group on aging. So he's just really a great talk story kind of guy from Hawaii. And we're very lucky to have him as part of the JSei talent here. And Diane Wong is our fearless leader who, my goodness, nonstop. We're glad she's taking care of us and being hyper vigilant and keeping us on our toes as staff, and giving us strong reminders. It's been really wonderful to have Diane's leadership. And I'm asking them to focus a little bit on senior care, our very vulnerable population. And many of us who are active seniors, I know, are realizing their vulnerability for the first time. They're used to going out and going on walks and, not asking for much. And now they're asked to shelter in and to be careful. And I know my husband's having a hard time with that. So Alan and Diane, if you could share some of your reflections.
Did you want to go first, Alan? You're on mute.
Oh.
He's still muted.
Okay, unmute Alan. Okay, Alan.
Hi.
Hi.
Thanks for allowing me to be a part of this. I actually jumped in. I volunteered. I wasn't asked, but I wanted to be a part of this. And what I want to focus on is, again, kind of to mirror what Barbara said. This is not normal. And the way we're reacting to everything is not normal, meaning that we're not going to be ourselves. And it really shows up when we're taking care of someone else. And I said the main issue that happens, I think, is when we don't know, when we're uncertain about something and we're in the unknown. We're not comfortable with that. We're not in control. We're not in control of how fast this goes. We're not in control of who's telling us what and what to believe. And what happens, I think, when, for me anyway, I don't feel like I'm in control, is I try and control things. I try and control my environment. I try and control my cat, who has her own mind. But I find it came up with issues between my wife and I, where we're struggling for control. We're struggling to get some sense of, I can predict this. It's going to be the way it's supposed to be. And that lack of control gets really amped up, I think, when you're taking care of a senior. When I was taking care of my mom, it's like I wanted her to do certain things, the right thing, and she didn't want to have me tell her what to do. And control is such a huge issue that comes up in any kind of relationship. And I think to normalize it is to say, when we don't have control, we try and control what's around us, because that gives us a sense of comfort, a sense of normal. And so that issue can come up when you're taking care of someone, as someone's trying to be independent and we're trying to make them listen to us. It comes up around wanting them to listen to us, and they're not listening to us, and we're getting more impatient. And part of the more impatience and more irritable, we're more angry, maybe we're more demanding. It's because we're stressed. It's because we want to control things. We want to control them, and they want to their freedom too. And and for me, I don't feel like it's like I used to enjoy being outside, but I lose that. It's like there's a grief period that I'm going through of what used to be isn't anymore. And so not that I take it out on someone, but that can happen because both people are, this isn't normal. We want things to be more consistent, and it's not. And what I'm trying to do as I deal with that is to have compassion for myself. And compassion meaning, that I think you said it, Barbara, also. It's like we're human. It's like what's going on is not normal. We're not behaving like normal because it's not normal. And the acceptance of ourselves, the acceptance of our impatience, our irritability, all of those things. It's like, can we accept that in ourselves? And as we accept that more in us, I think we can then be more tolerant and more compassionate with someone else. But compassion starts with us. We have to be compassionate that we're not ourselves. And maybe later, if it comes up, we talk about ways to take care of ourselves. You hear about the caregiver and how important it is for self-care, and it's absolutely important. And now's the time that we have to do it. And yet now is the time that it's hard to do it because we're prioritizing taking care of someone else. So we're struck again with that place of how do you take care of yourself? And one of the things that was mentioned earlier is we tend to kind of focus, the closed loop thinking, the rat in the cage that we go over and over again, and then it pumps up our body and we get all anxious and it makes us more anxious. And the simple thing is just to stop. And I remember when I was a kid, before we cross the street, they say, stop, look, and listen. And I think this can be used in our personal lives. When you find yourself revving up, stop. Notice that you're revving up. And listen, what are you telling yourself? It's doom and gloom, or if I don't do this, or if this happened, I wish it didn't. And you spin around. And the way to stop the spinning is literally to realize you're doing it and stop. It's like, take 10 breaths or something. And I find a nice way to do that is to be aware of your senses. You're in your mind, you're thinking. Well, be aware of your body. Be aware of, like, seeing something. I look out my window and I watch the leaves. Or I listen to the birds. Or I have my cat sit on my lap. But these are all sense things. Taste something. I've gotten addicted to potato chips because it's salty and it's crunchy and it feels good. But it's another sense thing because that brings you present right now. It's not happening tomorrow, it's happening right now. And so that's what I'm trying to do to stop the spinning. So I can pass it on to Diane.
Thanks, Alan. Well, it's just listening to Barbara, Art, Alan. I mean, there are pieces of everything they're saying that we all can identify with, right? I'm the obsessive compulsive person. My staff will tell you that I just nag them to death about cleaning. But I think in terms of how I see my role about caring for others, it's really caring for the organization and the community. So everyone we serve, our volunteers, our staff. And so feeling or wanting that control is critical because it means so much and rolls out, and the kind of risks that we take and what we can prevent is just always on the forefront of my mind. So there's really very little relaxation until I feel like we can get all the safeguards in place. So, you know, for JSei, that meant early on restricting who was coming in, and the board helping to develop policies around who was coming in, how are we running our programs, and you know, even now thinking about the nutrition program that's still going, what are our backup methods to make sure that it still goes? You know, how are we sourcing our food? What's our backup supply? Who are we contracting with who we normally don't? Just because we know they're a huge player in the industry, and we know that their chances of failure are much less than us going to, you know, our local shopping. So there's so much thinking about backup to staff, to the food, to everything we do. And then it's even more critical at JSei Home because they're so vulnerable, right? And also all the policies around who's coming in, how do we care for the residents, what happens if XYZ occurs, and literally responding to daily changes in licensing and regulation so that, you know, we're always updating the plan, working with staff. So, you know, once I think I realized how much I can do up to a certain point, and I try to relax. It's really hard. We did line up emotional support, stress kind of reduction with our staff, both at JSei Inc. and JSei Home, so that if they need to talk to someone, they can just call and arrange, you know, time to go through either talking it through or steps on how to de-escalate how they're feeling. You know, and the board's been really supportive of just making sure people use whatever sick time they need if something should happen. And for myself, I think, you know, my daughter had to move home to finish school, just like Jill's daughter is also out of school and, you know, schooling remotely. And that's been nice to kind of just bring me down because, you know, I got to feed her. I've got to be with her. So, you know, just going out on walks and being with someone you love just really helps. So that's the silver lining for me.
Great. Thank you, Alan and Diane. Yeah, so many things that we do, we're all interconnected and interdependent. And so it's really great to hear the different perspectives. I want to introduce our next two speakers, Satsuki Ina and Michael Yoshii. And I've known both of these speakers for a long time. I think we originally connected through work that I did when I moved to the Bay Area in the Sansei Legacy Project. But let me introduce Satsuki. Satsuki Ina is a psychotherapist, filmmaker, writer, and a community advocate. She's most recently the convener of Tsuru for Solidarity. And she also writes a column and facilitates a monthly dialogue titled Let's Talk on issues concerning aging in the Nikkei community. She always has a lot of wisdom and grounding to share. And so I'm so thankful that she was available to join us today. And our other speaker is Reverend Michael Yoshii, who's the pastor at Buena Vista United Methodist Church in Alameda. And Michael has been serving in that capacity for 30 years. It's quite a gift for the community and the larger community too, the church community and just the larger Alameda community. Michael always pushes us to think more globally, also locally, who our neighbors are, who our community is, and how we can have greater impact. And he never forgets about, you know, carrying the essential needs to care for each other, our families, and the others that we interact with in our community. So I'd like to introduce Michael and Satsuki and have them unmute their mics and share with us.
Thanks, Jill. Can you hear me?
I can hear you.
Satsuki, you want to go ahead? I can't see you.
Let's see. Did we lose Satsuki?
Satsuki needs to unmute.
There. How's that?
Good.
Great.
Okay, good. So thank you, Jill, for the invitation to participate. Actually, the other speakers have covered many of the topics and important issues. I appreciate Barbara specifically to identify disaster response. I thought I'd pivot a little bit and talk about some suggestions for coping that, you know, this is, Barbara talks about disaster, and my perspective is that we're really in the middle of a traumatic experience, and it's important to understand that we respond with fear when we're experiencing trauma, and it's easy to cycle downward, and people often suffer from symptoms of depression and anxiety during times like this, particularly when it's a slow-moving, chronic state of anxiety and vigilance that's required. So how to cope with that is what I'd like to just quickly cover. I think it's important to have some kind of schedule, because that's the one thing that we don't have right now. And we've probably moved out of the initial stage of being in shock, where we were oversleeping or undersleeping and kind of adrift, glued to the TV or the computer, trying to figure out what was happening that day. As we move forward, I think it'll be important to have a schedule, to decide to eat regularly and eat healthy. And also to see this as a way of learning more about yourself, like what works for you, what feels right, and organizing a schedule around not what your job required or what was externally imposed on you, but what your natural rhythm is. And to use this time as personal growth is what I think is really important. And so working into your schedule things that you enjoy, things that, instead of focusing on what you can't do anymore, take that. For example, I was going to have my family, my grandkids, and we were all going to go to Monterey for spring break, which was going to start this weekend. So of course we can't do that because they live in Brooklyn and Bainbridge Island. But so I'm scheduling a Zoom family call on Sunday, and everybody has been asked to dress like they're going to the beach, and also to share something that they've been doing during this time. So, you know, my grandson is going to show us a few of his skateboarding tricks. My granddaughter, 16-year-old granddaughter, is into fly fishing, so she's tied some new flies. So kind of thinking outside of the box so that you get out of the dreariness of being on threat level, and making sure that there's a way that you can use your sense of humor, your lightheartedness, and creativity with each day. You know, what can you look forward to? And you may have to be the one who is the leader in your family to do that. So to think about what your role may have been, but what maybe you can think about yourself in a different way than how you have. I'm of course very bossy, and my family expects me to lead all the time. This my siblings. And so I'm using that, but I'm also stepping back in some areas, asking my brothers to do some other things. But I decided that, for example, I have cousins all across the country that we don't see except when we have a family reunion every 5 years. So I created an email thread of all my cousins and asked each one of them to check in and tell us how their families are doing. And so we've had this communication going now for the past week. Some people are doing great, and some people have had to close their restaurants or drop out of school and lost their jobs, furloughed and things like that. But we can give them remotely support in ways that we've never really known each other. These are ways in which you can create new ways of being together, maybe even in deeper connection with each other. If you can think about how to use this time to deepen relationships is another way of thinking about this time. Because we are by nature social beings, and to have to social distance and shelter in place, we could feel like, okay, there's limits. But I think we can go beyond those limits and think more like, okay, how do I reach out? And so, you know, you might not be able to visit your friends, but you can have more meaningful dialogue on Zoom. I've been having tea parties with my friends, especially my friends who are living alone, where I tell them, I ask them to make their own tea. And at noon, I will drive up if they're on their front porch. This is not an essential activity, but in my sense, especially with my friends who live alone and who are elderly. So I ask them to make their own tea, sit on their front porch, and I drive up to the front of their house. I drink my tea, they drink their tea, and we have like 30 minutes of chatting and really seeing each other in person. And it has made a world of difference in terms of feeling like I'm cut off from them. I might get arrested as things lock down more, but I intend to keep having tea with my friends until I can't. And then the last thing I want to say is to do something for someone else is just another way to uplift yourself. To think about ways in which organizations that are trying to support people who don't have a roof over their head, who don't have a job to go back to, there are ways that you can contribute donations or volunteer over online to make calls, many ways. And of course, priority, if JSei needs any volunteers to do things like that, you know, we definitely want to sign up with JSei first. But there are national issues going on now that maybe you didn't have time for. A lot of these nonprofits now who are working on behalf of other organizations have had funding cuts. So find something that really means a lot to you that maybe you didn't have time for, that you could contribute, and even if that's just in your neighborhood. So those are my bossy recommendations. Thank you. Go ahead.
Great. So Michael?
Am I unmuted? Can you hear me?
Yeah. Mm-hmm.
Oh, great. Okay. So for me, I think obviously as a pastor of a church, I kind of want to locate ourselves socially in relationship to JSei. I think for JSei, going all the way back to when it was called JSEB, it was always an organization supported by faith communities, Buddhist temples, and Christian churches in the East Bay. And so I think for today's conversation, I want to, keep that hat on as a pastor of a church and a congregation, and see how we can be partnering better with JSei to help support one another, but also help support our community members as well. And so from that standpoint, I want to just share a little bit about where we've been from the beginning of the crisis. And my first thing I want to say is a word of gratitude to our Chen, who's part of our congregation, because before we went into shelter in place, Art, as a member of our church, did a briefing with our whole congregation. I think it was a month ago, Art, or before that, where he talked about what was happening and what we could expect, what's coming. As a public health official formerly with Alameda County, with a great deal of expertise and knowledge. And to me, that was a great comfort as a pastor to have somebody in our membership who had public health experience, who knew what he was talking about, especially when everybody was hearing so many different things, so many different kinds of rumors going on and so forth. And I think having people like Art in communities are so essential, and people like Barbara, who are part of the health professions, and they have the knowledge, they have the facts. And so having those facts, I think, helped our congregation right out the bat before we were going into shelter in peace. And he told us at that point, things are going to start unfolding a little bit at a time, and we just need to be flexible and roll with them. So by the time we got the public health order from the county and from the state to shut down our worship services and to shut down all in-person activities, I think we were well prepared to do that and to officially close our church offices, but to continue to maintain who we are as a faith community. And so what we've done is we've gone to online worship services. We don't meet in person, but we have online worship services. We've adapted to using Zoom as the medium for our doing our worship service. And we have Bible studies and prayer groups during the week, also on Zoom as well. We also belong, as a Methodist church, we belong to the Conference of Northern California, Nevada annual conference, and that's 365 churches in Northern California and Nevada. So we're having weekly briefings with our district churches, about 45 churches in the East Bay and in San Francisco, sharing what's going on in each of our congregations and the best practices for us sustaining our work as a spiritual community. Some of you may or may not know that along the way, faith communities were not listed as essential industries or organizations, but that shifted at a certain point in time. And there was I have to say with all transparency, there was a lot of politics to that for faith communities to be included as essential industries. And so our bishop then told us, well, we are now deemed essential. We continue to ask us to not have worship services in person or public gatherings and continue to close your offices, but continue on in what we do, and particularly the things we feel are essential. And some of that has to do with the services that faith communities provide to communities in need, particularly homeless services and immigration services, among other kinds of things. And so we've had to kind of literally navigate changing dictates from day to day and from week to week to determine how do we operate and what are the things we focus on. As a local congregation, I imagine we're just like the other Christian congregations and Buddhist temples in the East Bay that are part of JSei, where we're trying to maintain our basic operations, do our services, and most of all, keep in touch with our members and make sure that we're connecting with people. And so to have our Zoom worship sets have been really great because people can see each other in the gallery, and kind of a great relief for people to see each other, wave hello, and pass the peace to one another. And but at the same time, we're very concerned about those who are not accessing technology, Zoom video for us. And so we've had many meetings to talk about. In fact, I had a meeting last night with our leadership to talk about how do we maintain our contact with those who are not able to access the technology of Zoom. And so those who are isolated, those who may be seniors who don't have the technical capabilities. And so one of our members has recorded on DVD our worship services, and we've been distributing it to some of those who are at home with DVD players and able to let them partake in our worships together. But there's still much more that we're doing, and we're now creating a spreadsheet where we have a list of people who may be in need for anything from grocery shopping to errands run for them or other kinds of things that they need to be done. And then we're having a list of volunteers who are willing to do that, to take on those opportunities for volunteer service. And we're expanding that spreadsheet for ourselves and putting it out to our members. And it's something we've always done as a faith community, to figure out how do we help our members, how do we help the members who are most in need, and those who are most healthy are the ones able to then do those kinds of things. But I think it's accentuated at a time like this where there are folks certainly that are more isolated and more in need than others. And there are others who have time on their hands now and are able to participate in volunteering. One of the things I'm aware of, and I'm sure this is the same with other faith communities that belong to JSei too, is that in a congregation there are just range of differences in terms of how coronavirus is affecting people. So there are people like Art who are part of our congregation who are really busy doing all kinds of things in the public health sector, educating people, going on Zoom meetings like this to help share information. people who are nurses in our congregation who still go to work at hospitals, people who are in health clinics, people who are educators and teachers who are having to Zoom into their schools and to their students to do online education, others who are working from home, and many now who are at home working remotely, but then dealing with their families and dealing with their children and trying to navigate their schedules of homeschooling and all that. So us trying to be aware that there are very diverse situations in each household, and yet for us as a faith community, what we have and what we hold in common is our spirituality. It's very important for us to continue to share that message that spirituality matters. Spirituality is very important for us at a time like this, where there's a crisis taking place, that we all need to be spiritually centered, whatever tradition we come from, that our spirituality can give us inner peace. Spirituality can help center us and ground us in the reality that is not just the moving targets of things that people are talking about on little hits on social media or on TV or whatever, but there's an essential reality that exists that's spiritual, and that we all belong to that world, but that to be cognizant of it, to be conscious of it, and to be grounded really helps each and every one of us navigate the reality that we're dealing with at our homes or whatever our workplaces are. And that spirituality is probably one of the most important things for me at this moment in time for everyone. And so we continue to provide that essential service, and I think all of our partner temples and churches will be doing that as well during this period. And we encourage people to re-engage in congregations where people haven't been engaged, but also to support the congregational life where people are already connected to communities of faith. The other thing I would say too for communities of faith is that we are also in the enterprise of disaster response. In our conference, we have a disaster response staff person, a full-time staff person in our conference who deals with disaster response throughout our whole area. Recently, of course, we've had the fires up in the northern areas of Napa and Solano counties, and they've been busy doing that work for months. When I first came to Buena Vista, you may remember in '89, there was the earthquake. And that earthquake really rocked us here in the Bay Area. And what we set up was a command center in Oakland, and our partner church, Oakland Taylor Methodist Church, near the 880 freeway, where that was our kind of hub of our disaster response for congregations in the Bay Area. And we had our international agency, United Methodist Commission on Relief, which is one of the largest international relief agencies, come in to help resources as well. So faith communities are well equipped to deal with disasters, but it's from our position as faith communities, not necessarily from the expertise that other people bring in terms of the scientists and the health educators, but we play our part in organizing that. And so I think as things move on and things continue to unroll, we'll see our faith communities, all of the faith communities that are part of JSei, potentially being hubs of helping to respond to how we perceive the unrolling disaster take place within our congregations and our communities. And then, of course, we are faith communities would deal with everything from birth to life and death. And so we're mindful of people that are engaged and having challenges with people that are having the crisis of the diagnosis of the virus. And we expect that to, although we've only had one family who knows of persons in Seattle who actually got the virus and passed away last week, a husband and a wife. We haven't had any other members of our church that we know have been diagnosed with a crisis, with a virus or dealing with that. But of course, spiritual communities always are in that place of helping people through the passages of illnesses, and whether it gets to the point of the passage to death. That's who we are. That's what we do. And so this is what we need to help prepare people with in the case that the unfortunate situation should happen, that there are people that are diagnosed or people who get extreme symptoms, and we have to help support and walk people through those experiences. And of course, our spirituality is communal, it's collective. And so we have to maintain our sense of collectivity and our sense of connectedness as a congregation. Jill also mentioned to you that we also want to keep in mind the global perspective on this as well. And we have partnerships in our larger church with folks in the Philippines with human rights issues there. Philippines is a very volatile place and a very fragile place it's been ongoing for many years with many human rights abuses taking place. We get emails regularly from folks on the ground there who are dealing with the situation there, and we see the inequities of how health services are being distributed there with the coronavirus. And it's the most poor, the most marginalized who are being left out. And there's also human rights workers are being targeted by the Duterte administration. So this is a human rights issue, it's a social justice issue that we have to keep our eyes on and know that we have a place in it as well, even though we're here in California in the Bay Area, that we also have a voice in that. We have partnerships in Palestine. I just got emails yesterday from photos of people in the partner village we have in the West Bank of Wadi Fukim, where they have successfully done a lockdown for health there, where the virus is spreading as well. And they've shared proudly photos of how they've done their organizing there. And in the West Bank, the Palestinians are so proud because they're looked at as a model of how people work together collectively to deal with a health crisis like this. And the reason why they say they are able to do this collectively is because they live under occupation. And living under occupation, they have to deal with these things all the time of emergencies when people have to stay in the home and not go out because there'll be military incursions outside and it's not safe to be outside. And so they've been looked at in the West Bank as a model in the Middle East for how to do collective safety practices and doing things together. But on the other hand, in Gaza, which is the largest open air prison in the world where people are jammed together, they're having a major health crisis now because of the safety issues there. And they're crying out for help around the world to lift the blockade in Gaza to make it safe for people. And that then echoes to us also the ministries that are going on in our conference and some of our partners, particularly Interfaith Movement for Human Integrity, that are calling for the governor to release detainees from immigrant detention centers now, both for the moral reason that they shouldn't be there in the first place, but secondly, it's now a health hazard for the detainees to be in crowded facilities where the virus can be spread much easier. And so they're very much pushing on that and asking faith communities to be an additional voice to call the governor to help release those prisoners, those detained, and also to ask congregations to help provide safe spaces for quarantine for detainees if they are released, because they're going to need a place of quarantine for at least a couple of weeks and maybe even longer before they can move on to be with their families. And so these are ways faith communities and communities like JSei can also be involved in these kinds of larger policy issues and ways of being able to be supportive communities for those who have the greatest needs. The last thoughts I want to share with us too, we've talked a little bit today, and I appreciate Alan, his comments and his expertise as a mental health practitioner, and we go way back as well. But talking about control and how we want to be in control now, I think that's where spirituality comes into place as well. When you're really practicing spirituality, you let go of control because you know you're not ultimately in control of anything. And while we need to be on top of things and be able to look at what we can control, there's the old adage that we have to let go of the things we cannot control and then let go to the higher power or spirituality, if you might say it, so that we can kind of live with a greater sense of spiritual freedom to just be ourselves and not have to overcompensate to the things that we just don't have control over. And then also the comment about the new normal or things are not normal. But I want to share with you some of my thoughts on that, given our global relationships with others. Our normal is not normal for other people. The Palestinians who we work with, they're living under occupation. That's the normal they've been living with for 70 years. But that's not our normal. So how they respond to things is according to the normality they've been living with under occupation for 70 years. And so that's why they're able to engage right away in responding to these kinds of emergencies, because that's their normality. And I think we need to be thinking about relative normality around the world, and that this is an opportunity for us to all raise our consciousness about the fact that our normal in the US is not normal at all. Our normal in the US is a very cocoon reality in a bubble, because we have this sort of illusions of protection through the way our culture operates in the United States. But that globally, our normal is not the reality of the normal around the world. And that there needs to be a greater sense of intersection and consciousness raising for ourselves. And I believe this crisis is not only consciousness raising for the health hazard that's happening for people in our own communities and around the world in terms of coronavirus, but it's also consciousness raising opportunities for us around many different issues around the world that many of us are just not paying attention to. And so I just want to commend that to you from the point of view of a spiritual perspective, and also the praxis of spirituality as well.
Thank you, Michael. And thank you, Satsuki, for sharing and your reflections. We've received a couple of questions, so I want to move to that. We're learning a lot from each other, and as questions come up, I want to remind our participants or audience members, there are a couple ways you can ask questions. So you can go to the participant or no, the chat section at the bottom of your screen. You can send a message to Kathy Hashimoto with your question, or you can go to the participant button and you can raise a virtual hand, and later we'll actually let you raise a physical hand, which sometimes it's hard to get through all this technology to kind of be seen and heard. But I'm going to start with two questions that actually were sent via the chat. The first question, I think it's addressed to Barbara and Art. It asks, could someone let us know what are mild versus moderate COVID symptoms? So Barbara or Art?
I'll go ahead and start, and then Art, if you
Sorry.
can jump in.
Sure. I had to find
Or are you ready?
No, go ahead. Go ahead. It's fine.
Get that. So mild symptoms would be, I'm feeling a little bit sick. I've got a cough, I've got a low fever, but I'm getting through my day. To me, that would be mild. Or if somebody who has tested positive, although testing isn't that common in our area right now. But that you're still able to take care of yourself, to cook your meals, and you're feeling like you're doing okay. To me, moderate is kind of higher fevers, fever of maybe around 100, and a persistent cough. And I think the danger sign is when you're really having trouble breathing and you're working to breathe, and that is a danger sign. But see, the other piece of this is whether you have underlying health issues. So that if you have moderate symptoms and you have a history of respiratory illnesses or pneumonia in the last couple of years, or you're elderly, or you have diabetes, then that also is more alarming. And I think the bottom line is to call into the call centers.
Yeah. So I agree. I think that's a really good description. I'd also say, that in a way, it doesn't matter right now as far as, mild or moderate symptoms. It's like, pay attention, take care of yourself, at the slightest notion of feeling a little bit under the weather. And then this distinction between when you start getting short of breath, particularly if you have other illnesses, that's a really important distinction. And so if you're not sure, definitely call in and talk about it. Some of the nice experience that's coming out of different parts of the world who have gone through the surge, earlier than us, have come out with some recommendations on how to make that distinction. And one of them is that because the COVID virus ends up attacking the lung and then also attacks the heart to a certain extent, these receptors that are there, that it causes an early fibrosis in the lungs and that starts restricting the lungs. And that's where the shortness of breath comes. And so one of the recommendations they've said, which is not codified by, controlled trial research, but is just something of a tip because it's harmless, is to try to hold your breath, for 10 seconds. And if you can hold your breath for 10 seconds, there's less likelihood of it really being serious. If you can't hold your breath for 10 seconds or can only hold your breath for a little bit, then that may be an indication that you have had some of that fibrosis. Now, if your baseline is that you can hardly hold your breath anyway because you've got emphysema or you've got chronic bronchitis, some bad lung disease or bad heart failure, then this wouldn't apply as much because you already know you have compromised breathing. But for people who are otherwise healthy, this can be one of the things that you use to be able to gauge that.
Thank you. Our next question, which I think is just to Alan or maybe Satsuki. I'm interested in learning or receiving advice on how to work with people who are generally anxious during regular times, and now the crisis magnifies those anxieties, and how to support those people. So Satsuki or Alan?
Satsuki, you want to?
Okay, all right. So the helpful thing to do is, I'm not sure if this is a professional asking this question or just a family member, but anxiety is a heightened state of awareness and vigilance. And what you want to do to relieve the anxiety is to get the person to calm their system down. So meditation practice, listening to soothing music, instead of being repetitively stimulated by watching the news or talking about the coronavirus. So some time to shut down and let the system know that in this moment that you're safe. So if it is, however, an ongoing serious mental health issue, probably be a good idea to refer the person to an online therapist to talk through. But the idea for the response to anxiety is, like Alan brought up, and maybe Alan, you could talk more about this, is paying, the symptoms show up in the body response anxiety. So the blood pressure heightens, breathing is shallow, muscles are tightened up. So the relaxation techniques, the breathing, meditation, things to calm and soothe the system is what's in taking baths, and avoiding people and stimulus that aggravate the person's sense of safety. Go ahead, Alan.
I think one thing that's important is, and the way I see it anyway, that anxiety starts in your head. It starts with your thoughts. It starts with fears. It starts with future tripping or beating yourself up for something that already happened. It's like a mental activity. And the mental activity leads to the physical activity of constriction or agitation. And so I would suggest that one way to address that is, in a sense, get into your body. And into your body meaning to exercise, to walk. And that's why I said use your senses to smell, to taste, to touch. But it's like not quite cutting off, but using your mind to focus on something other than your thoughts. I think the thoughts are what actually is the engine that drives it. And the idea is to go to where it affects you, and it affects you in your body. And when you can concentrate on you're not breathing, or you got a sore stomach, or you feel pressure on your chest, then focus on your chest and in a sense communicate with your body versus be stuck in your thoughts. So I think the thing to break is the disconnection between your mind and your body, to really have your body be what speaks to you versus what your mind's telling you. And I think exercise or moving is the easiest, fastest way. I think it's really hard to sit and meditate when you're all jazzed up. And I think it's a lot easier in a sense to use the energy in a sense of like cut wood or take a walk or weed or something like that. Anyway, that's what I would suggest.
So let me just add one small part here is that as Alan mentioned, you know, it's the thinking that often stimulates the physical response. So sometimes it helps for the person to write down what is it that's racing through their head. And because you'll often find that these thoughts are irrational, and during a disaster time, the person doesn't know how much is irrational and rational given we have no control over what's happening. But making them conscious so that they're not just racing and circling through, but to write them down and then to talk to somebody about it. This is what I'm thinking. And oftentimes it is the fears about the future, regrets about the past, projecting possibilities that no one really knows about, and helping the person get to more in the moment, day at a time. What is happening right now? What do we know can calm that nervous system?
Hi, this is Barbara, and I have another kind of paradigm from the disaster field that I think is also helpful, because this particular disaster, on the one hand, a lot of us who are not sick are feeling like this is all surreal because everything is fine. But it is a disaster that threatens some of the most basic things that we touch on when we're dealing in major disasters, which is the pillars of survival. And that is food, shelter, and safety. So in regular disasters, we kind of try to meet those first. But people are also scared about their food, their shelter, and their safety in this particular disaster. But sometimes it's a little harder to pin down, because the food, you know, is there later on going to be, am I not going to be able to get enough food? Am I going to be able to pay my rent? And I never feel safe because anybody walking down the street could have the virus. So I think going through those basics with people can sometimes be a little bit helpful. You know, okay, well, how are you doing on food? You know, do you need help with your food? Do you need a ride? Maybe that's something that would actually help them to feel a little bit more grounded if they know that you're available to do groceries for them. Or, you know, I'm worried about my rent, but they haven't quite focused on the fact that their evictions have been suspended in California and they have legal backup for that. And then their safety. Okay, how can you feel more safe? You know, 6 feet, how long is 6 feet? And do you have a mask, or can we make a scarf? So going back to those really fundamental survival things and walking through them to see if they have gaps in their safety net can be a bit reassuring. And distracting's not quite the word, but it's kind of refocusing on, okay, you've got those 3 things figured out, or we're problem solving them. Can be a little bit calming to them.
Thank you. So thank you for that. So we don't have a lot of questions yet. So I'm wondering, it's probably this whole new fangled Zoom thing. We tend to be a very quiet audience anyway, as Nikkei. So I want to encourage people to, I'm going to go through my gallery view now. Oh, I see a hand. So Vida.
Right. Can you hear me?
Yes.
Not being one of the quiet ones. For
Please.
those of you who don't know me, I'm a case manager, blessed to be working with this wonderful organization. I just want to throw out, I got a call today from an elder, another elder, who I haven't spoken to in maybe a year. And she just called because she's lonely. She's in place, she has some medical issues, she hasn't been going out. It dawned on me that maybe each of us can look through that old phone book and there's somebody out there who we haven't talked to in a long time. We may not even particularly like them, but that's okay. But maybe they're isolated. So I don't know, maybe somebody talked about having a schedule. Maybe you schedule that, once a day, once every other day. Just gonna call somebody that's isolated, that's alone, give them that sense of security and safety and not feeling, I cannot tell you how important it is. I'm fortunate enough to be working at home. And of course, part of my job is to call my clients who are mostly seniors and at home. And they just love just my calling them. They don't have to even like me. They just like my calling them. So, maybe there's somebody out there that you haven't talked to in a long time and they would like just somebody to say hello to. Thank you.
Thanks, Vida. So you can also make comments. You don't have to, ask a question. So if anyone wants to make a comment, I'm looking through the gallery. Raise your hand. Let's see. Michael, you're raising your hand.
Yeah, I wanted to just piggyback on Vita's comment that I know with JSei now, you suspended, activities of delivery of meals and things. So I was curious about or have you suspended delivery of meals? No, you haven't.
We suspended for a few days, and then we reinstated lunch delivery Monday, Wednesday, and Friday, and also frozen meals to cover Tuesday, Thursday, and the weekends.
Okay. So connected to what Vita was saying about the phone calls. So at our church, that's something that we were working on last night in terms of the phone calls to our elderly members and being in touch. And I'm wondering if that's something JSei volunteers within the organization will be picking up too. And I know somebody who would love to have a phone call. That's my father.
I wonder who he's talking about, Diane.
He misses the JSei activities that he can't come in person.
Yeah.
But even him, he's 98 years old, but he doesn't think he's old.
Right.
Yeah, he's very social.
Yeah, and so he probably could make phone calls if you asked him to.
So what we've been doing with everyone receiving the nutrition at the lunch program, because they're the most vulnerable and isolated, is they're getting automatic calls from staff already. People on our home delivered list. And then I think just this week, we are finalizing people that come in for classes and that they'll start getting phone calls too. So if your dad, he comes in for congregate dining, we should probably get him on one of the two lists. But so staff, they're calling everyone who usually comes in.
Thank you. I see a hand raised by John and Amy Funabiki. You have to turn your microphone on, John.
How's that?
Uh-huh.
Hey, so thanks very much for doing this. It's been really great. Amy and I are enjoying this and getting a lot of tips. Just related to this conversation about telephone calls, I'm just passing on a suggestion that might routinize it or make it easier. And I'm borrowing or stealing an idea that I learned about from the Hmong community. Nationally, a group of Hmong immigrants created essentially a call-in radio show that they do with freeconferencecall.com. So they have a schedule of hosts who are ready to facilitate a conversation, and at any time of the day, people across the country, in this case Hmong immigrants, call in, and in this case it's in language, but they have different subjects that they talk about. And so you could very easily create a free conference call channel, and maybe operate it at certain hours during the day or the week. That's all.
Thanks.
That's the suggestion.
Mm-hmm.
Jill, why don't you mention what you're trying to get online too?
Okay. So a lot of our classes, all of our instructors have been great. They've been reaching out to their class members. Several of our classes are now online. The ones that are open to anyone to join are our yoga class Tuesday mornings, our Tai Chi. There's a new Tai Chi for arthritis class, actually intro class on Fridays that Noble is setting up. And the ukulele teacher is doing a sing-along, and that's for beginning and advanced, and anyone can join. And we're looking at other ways. We're trying to figure out movie night, how we can enjoy that together. I'm thinking of other ways we can maybe have a chat with like a filmmaker and all, watch the film ahead of time, or maybe a food blogger, try one of the recipes and then log on and have a chat with the food writer. So different things like that, and we're open to other ideas. I'm also working with our staff, Miyuki and Noriko, and one of our instructors to offer this kind of talk for the Japanese speaking. And so I'm also looking for help with tech, because I don't speak Japanese and our tech Eric doesn't speak Japanese, but I'm sure we can find resources. So we'll be hosting that as well. So there's different ideas that are popping up, and we're open to helping those things to happen. So if you have an idea, we definitely have people who are interested and anxious to connect in different ways. Some of our volunteers are actually meeting and having their tea time. I thought of Satsuki's example. They used to volunteer on Thursdays, and they miss having tea together. So they dress in their aprons and their headscarves that like they used to wear at JSei, and they have tea and they chat. And I think they also share their treats with each other virtually. So those are some of our ideas. Let's see, I'm gonna look for more hand raising. No hand raising. Okay, so I'm gonna let our speakers, I see some hand raising from our speakers, and I had offered to them that they might want to make any announcements or let us know of resources. And I'm happy to share with the audiences some of these referrals. Art sent me in chat, and I can send that via email to folks. So, so our speakers, I'm going to go in a different order. So let's see. So if we could have Alan and Michael, if you want to make some comments, closing comments, or any resources for people.
I didn't want to make any comment, but I did want to ask another question.
Okay.
That is, I don't know if it's even possible, but is it possible that JSei could be a testing site? Because I know that different places are being, asked to think about spaces being testing sites, and I'm thinking with, the cultural sensitivity of our community and the comfort level people have of going to different places. I'm just wondering if that is a possibility, and maybe something Art or Barbara might have more knowledge about, and or Diane, if you've had any conversation like that.
I haven't heard anything about that. We would have to certainly work around the nutrition program because there are a lot of people cooking, volunteering, getting the meals out. So, you know, that's just the first thing we'd have to work around, but I've not had any requests.
So this is Art. You know, this is happening spontaneously, and I think the idea is a good one. You know, Michael, it's fraught with a lot of challenges, though. The issue of, you know, accessible places for people to get the tests is not so much that there aren't enough places. It's the problem is the test, and not having the test available for everyone. It's still being prioritized for healthcare workers, and then people, you know, of course, that have really bad symptoms. And that isn't changing right away, but it, you know, it could change any day. You've, you know, all heard the news that private companies are ramping up and are making things accessible. I think probably the most important thing about that is when people get the tests is to be able to continue the communication flow so that test result, of course, gets back to the patient, but then also, you know, gets back to whoever their providers are, who they relate to, whether they're followed more closely by a primary care provider or a specialist, you know, or in a clinic setting or in a hospital-based setting. And then the test, you know, gets also funneled into the public health department so that we can keep track of how, you know, the epidemic is spreading throughout the community. So, you know, to hit to your point though around cultural sensitivity, you know, we're really, that's a long time effort. Barbara can, you know, relate to this. We've been fighting that battle for a long time, that any place you go to in this area, certainly in the Bay Area, you should be able to, you know, experience some type of cultural sensitivity. We know that that's not true in every place. But we still, you know, continue to push for that. To the extent that it's a deal breaker, to the extent that people will absolutely not go to a regular lab or to an office in order to get the test because of cultural issues, that creates a, you know, a new challenge, I think, and something at that point where it might be worth talking about, but it's nothing that I would recommend, you know, at the present time.
Hi, this is Barbara. And yeah, I agree with everything that's been said. And I think it's a great idea. And it's just that its time has not come. Because I think that there will be a point where testing will become available. And it will, and probably antibody testing as well as, you know, the active virus testing. And it may be much farther down the line, but I think we will reach a point where it would be good if JSei could do something like that. But the two things that I think, or the one thing that I think is really important is that there's been so little testing. We probably do have people in our JSei community who are positive and don't realize it or are going to become positive, and that our case managers are going to be really, really huge, because helping them figure out and giving them the support. Okay, where am I going to live? Should I go to the hospital? Can I stay home? What do I need if I'm going to stay home? You know, what kind of support do my caregivers need? That all of that is going to be something that JSei is really well positioned to do, is to case manage. We're so far behind because testing has not been available. This is something that we would be doing now, I think, if testing was more available. So I think it should stay on the table. But it won't be happening, you know, in terms of being a site. It won't be happening that soon. I think us having cases that we know of will probably happen next week.
Wow.
I just received another question for any of our panelists to address. Have you received any input from individuals dealing with experiences of racism during this time? So one of our members, Yokoyama, is interested in supporting, you know, that And we haven't quite figured out the best way to do that, but whether it's, having another talk based on issues of anti-Asian racism. Michael?
I just had a long conversation yesterday with one of our members who is in conversation with a lot of the coalitions working on that issue. So I can pass, it's Wendy Hanamura.
Okay.
And so she's networking with folks, and I can pass on her contact to, well, you have it, Jill. You can.
Yeah, I have Wendy's
You can
contact.
connect her with
Right.
that person.
And Satsuki, you sent something to me earlier today too. Satsuki wants to comment. I think it's just really that there's incidences in San Jose that people they're aware of, and they're wanting more reporting, that there are incidences happening that are not being reported.
Yeah, I think that's one of the important things is that I think our community may experience some of this, but not report it. And it's really important that we gather information so that we can get the kind of response that we might need for our safety. So anyone that experiences from comments to anything physical or verbally assaultive can call JSei, and we could start collecting data and information to pass on to those who are gathering information. So not to ignore it or be quiet about it is going to be really important.
I want to go back to your initial invitation, Jill, about what we can do. I like the idea of, like, I think we talked about it a little bit, like the doctor is in, have like either a group or a Zoom meeting where every week, once a week, kind of like maybe what we have right now, that it's open to whoever wants it. So people can get that contact, that the visual, the auditory contact, because I think contact is so important. The ARP had something about loneliness is one of the big things that a lot of the seniors deal with. And for me, this being able to listen to each other, to see each other, is helpful. And it can be light, it can be how come the A's are going to leave, or the Raiders are going to Vegas or something, but some kind of organized. I mean, it's like every Tuesday at 3:00 or something like that, where people can do that, and maybe we can work on, like, how we gonna staff it. But the idea of weekly contact. That's my idea.
Yeah. So we weren't slating Art Chen to be on call every week, but I think the doctor is in was kind of the phrase that Lucy.
Yeah, Lucy in Peanuts.
Setting up her sign saying the doctor is in, and
yeah,
come and chat. So a couple of responses. The Chinese for Affirmative Action has a formal way of reporting racism from C19, and you can go to their website for access. So that's a good resource. And we have another question about if a person is test positive for coronavirus, how long do they remain positive, I guess? So.
I don't think we have any idea how long they remain positive, but the quarantine idea, once you test positive, to self-quarantine was for 14 days. But yeah, one of the things is that we don't have the antibody testing and things to figure out how long they stay contagious.
Right.
You have anything to add, Art?
Most of that information is being compiled, and a lot of it is coming out from coming out from China and from Singapore and Taiwan. And they're trying to, probably the more significant question is, how long, are you shedding the virus to the point of being contagious? And, there's some estimates that, the peak of your symptoms, and trailing off, is maybe around day 7, 6, 7, 8. And then after that, there's a real drop in the viral load that you're carrying. But we are just compiling that and really don't have anything definitive to be able to offer, even because we know that in some cases, people are continuing to carry the virus for up to 2 to 3 weeks after their symptoms have been resolved. And so whether or not that means that they're infectious, we don't know. And so the hard part is for someone, who's already gone through the illness. The quarantine period is, this 14 days, but the hard part is we really don't know. And better to play it safe in the meantime.
Okay, well, I want to be mindful of our time, and just a couple of encouragements for our listeners. We have some polls up, and I don't know if anyone responded. So I'm going to, okay. So we had the first poll, and maybe we can share that, but it looks like we moved to the second poll. So the second poll is more for feedback for us, just feedback on this forum and your ideas for others. And also, in addition, I'm happy to receive emails if you want to elaborate some ideas with us. But as soon as people start to populate that, we can kind of share the response. And I'm wondering if we can look at the response or share the response from the first poll. I'm not exactly sure how to do that. Let me try and do that. Okay, maybe we can't do that well when polling is through. But while we're doing that, Diane, do you want to kind of give some closing comments or share some things that's going on with JSei?
Just in closing, I just want to say the community's been great. We've had a few pressing needs when the shelter in place happened and people over 60 were recommended to stay home. We had a whole new crew of volunteers come in and rescue the program, thanks to UG and that kind of younger group that came in. They're still coming in, helping us cook and deliver. So, and then we had over 200 masks made for JSei Home and staff and volunteers, and those people that are crafting and sewing just came out of the woodwork and saved us yet again. So it's been so great to just be a part of this community and have never felt alone. Really just have always, nice one, Jill, have always felt that, if there's a need, people are here responding. And under Jill's encouragement, we put out messages via e-blast and on our Facebook site too, that if people are able to help support the nutrition program, that this is a great time as we're getting out so many meals. So thanks to everyone for just being with us through this really crazy and tough journey.
I see hand clapping, Diane. Okay, let me see. Okay, I'm going to share results. I think I am. Let's see. So I'm sharing results for the first poll. Oh, the second poll. So 54% superb, almost like being in the same room, 46% very good, and 4% good. And what would you like to see more of? Current issues is 79%. And the others, films, arts and storytelling, and small group conversations. So we'll take all of those recommendations into our planning. And I welcome any additional input from all of you and participation. So thank you again to all of our guests, Art Chen, Barbara Morita, Alan Maeda, Diane Wong, Michael Yoshii, and Satsuki Ina. It's been really a gift to have you as part of our community. Thank you.
JSei staff, you rock.
Thank you, Jill, for coordinating everything.
Oh,
Thank you, Jill.
You're quite the tech wizard.
yeah, it's my people in the
And
tech.
thank you, Diane, for making it all possible.
Oh, thank you, Vita.
Thank you all.
Thanks, everyone.
Thank you.
Thank you.
Bye.
Thank you.
Bye.
You,
Thank you.
Bye.
Stay safe.
I don't know how to get off. Oh,
Leave meeting.
Yeah, leave meeting. Oh, hi, Donna.
I.
Some people snuck on. Didn't get to say hi.
How do you get on?
So did she put all the information or?
You.
Oh, no, she hasn't responded.
How do you do the classes?
Okay, bye.